showing up in area emergency rooms when it comes to COVID-19.
Yeah, medical reporter Liz Bonus shares why doctors say many people diagnosed with the virus may need to be treated for blood clots.
Hey guys, hello to you. A hidden danger with COVID-19 and the brain. Researchers in JAMA Neurology found the stroke rate is 7 times higher in those who show up in the emergency room with the coronavirus than those who have the seasonal flu. Here's TriHealth emergency medicine specialist Dr. Chris Zammit.
I think really the underlying problem we're seeing with patients who are particularly sick from COVID-19 is an increased risk for clots to form. And those clots can be either in the veins or in the arteries. So when we're taking care of patients in the hospital, we're putting patients on blood thinners. Actually, we're putting them on a little higher dose of preventative blood thinners that we use in other patients when somebody's really sick to help prevent the clots from forming in the veins, and particularly when it goes in the veins, those clots can go into the lungs.
Zammit's team also recently published a separate study which showed people on average were showing up 2 hours later to the emergency room to get care after having a stroke compared to before this COVID-19 pandemic.
What we already know is that if you delay treatment for a stroke by just 15 minutes, you have a reduced likelihood of being able to walk again, to go home again, to survive. And when we treat you for your stroke, you're more likely to bleed into your brain as a consequence of it.
Now a reminder, that means you need to recognize the warning signs of a stroke early. We often refer to this as the FAST system. It means facial drooping, arm weakness, speech difficulties, and time to call 911. I'm medical reporter Liz Bonus. We'll throw it back to you.
Thank you, Liz.